welcome to another episode of Matt Talks Back. This one, episode number 11. This is a really interesting one. You know what? I put up a post about a week ago just explaining to my followers that this was going down, and this has been the biggest response that we've ever had from one of those previews that we've put down. So thank you very much to James Britton. James Britton joining us on the show today from Mexico Health Concierge. James, welcome to the show.
Thanks, Matt. Appreciate it. Thanks for having me.
Absolutely. Now, first of all, I just want to start off the show before we even explain who you are or what you're about with some stats that kind of have me concerned here. I knew that healthcare in Canada was kind of in trouble. I don't think I knew that it was quite this bad. So let's go over this. Some stats from Canada. Canadians who died waiting for healthcare in 2023-2024. At least 15,474 Canadians died while waiting for healthcare, specifically surgeries or diagnostic scans, between April 1st, 2023 and March 31st, 2024. This according to data compiled by secondstreet.org from provincial governments and health authorities. Now, this figure is incomplete because several jurisdictions, including Quebec, Alberta, Newfoundland, and Labrador, and most of Manitoba, either did not provide data or only provided partial information. For example, Saskatchewan and Nova Scotia only reported deaths of those waiting for surgeries, not diagnostic scans. That's scary enough, but then you get down to the Canadians that were waiting for medical treatment in that 2023-2024 range. Over 3.1 million Canadians confirmed to be waiting for surgery, a scan, or to see a specialist. However, due to incomplete data from some provinces, again, the actual total is expected to be closer to 5.1 million people. That is 1 in 8 Canadians across this country. That includes those waiting for a variety of treatments and consultations, reflecting ongoing challenges with healthcare capacity and wait times across the country. And this is not an equal thing either. It gets worse depending on where you are in the province or which province that you're in. Now, today, of course, we do have James Britton joining us. Let's get you back on camera there. There we go. James definitely has some experience with some of these issues that we have here in the North. James, tell me a little bit about where you're from. Now, you're from the Smithers area. Is that where you grew up?
Yeah, so born and raised in Smithers, BC. My children who were born in Smithers would actually be fourth generation from Smithers. Right. And actually, I'm just going to quickly, you can call me Jim, actually, Matt. You don't have to call me James. It's actually funny. Everyone calls me Jim or Jimmy from Smithers or anyone else that knows me. The reason I use James is actually because in Mexico here, people have a hard time pronouncing Jim or Jimmy.
They would too, yeah.
The J is silent, and that's the only reason I use James. So Jim or Jimmy, all good. James sounds a little too official for me most of the time, except when I'm in Mexico because the alternative is comical. But so born and raised in Smithers. I spent my youth there until I was 19 years old. And when I was 19, because of a family business, I went to Mexico. We were in the mining industry, drilling to be more specific. And we opened an office in Mexico. And initially I went to work on the rigs. And then from that, I became the manager of Mexico and Latin America. And made the permanent move to Mexico and met my wife and made it home.
Living the northern BC dream, growing up in those winterous mountains, which is wonderful, let's be honest, but some of those winters get a little long. So at 19, you got to go to the land of the beaches. That's living a couple of epic lives in one very short lifetime.
Yeah, I before going to Mexico, I spent 3 or 4 winters in northern Manitoba working on the drill rigs, and so it was very, very pleasant change of scenery compared to northern Manitoba and Saskatchewan in the winters for sure.
No doubt. So you went down to Mexico. Another interesting thing about doing that is you get to see how countries do things completely differently as well. So that's an interesting perception that you got while you were down there too. You know what? Why don't we dive right into the deck that you put together, because that kind of tells your story right from day one kind of thing on this thing, kind of from where we are. So let's get into that. Here we go.
Absolutely.
Okay, so you sent off this awesome deck, and you know what? I'm just going to let you pitch it, and then I'll just kind of ask you questions as we go along and clarifications, if that's okay with you. So just let me know when you want to flip slides. Okay?
Absolutely.
All right, here we go.
Yeah,
So
yeah,
these
let's
are the
do it.
numbers we were just talking about here.
Yeah, that's right. Yeah, so those numbers are horrific, and then maybe another number or statistic that's not there and a bit more closer to home being British Columbia. Approximately a month ago, the Globe and Mail had an article come out that said in the next year, just in BC alone, there was 435,000 British Columbians contemplating traveling outside of British Columbia for some sort of medical care. So, wow. These are big numbers, and scary, really. Who would have thought that there was so much need, so large of a demand? When we started this project, we knew there was a demand, but we actually really didn't know how big of a demand it was. Yeah. And when we actually initially started, we thought, we'll offer this service to Americans and Canadians. And then from there, we realized very quickly that, in Canada, there's most certainly enough of a market for us to focus on Canada. And then from there, we realized, we actually can start in BC, and even in northern BC, there's a big enough market to get us started. There's so much demand right now.
Yeah, 100%. Yeah. I mean, people can take a look at this here, but these are the exact numbers we were just talking about there as we kicked off the show. Let's flip on to the next slide here.
Yeah, so that's just a little bit about us. So we talked a little bit about myself, born and raised in northern BC, but went to Mexico 30 years ago to do the drilling business. We actually sold our drilling business, though, about 15, 16 years ago now, and we did some other things after that. And here, probably about 5 years ago, my son, who's a soccer player, before I get into that, I'll back up a little bit about who we are. So myself, born and raised in the north, and then my wife, Lola. My wife, Lola, is actually a Mexican national, and she's actually a really big part of the company as well. She is in charge of our client relations, and she's the one that spends a lot of the time with our clients when they're in Mexico receiving their treatments or procedures. And so one of the important things about our service that we offer is, and one of the reasons we call it concierge service, is it's not a service by which we're kind of, getting your information and sending you off on your own and wishing the best of luck. We're actually boots on the ground. We're there in Mexico, or in this case in Guadalajara. And so, for example, Lola's part of the business is she'll be the one going with you to your appointments, be there waiting for you while you're having a procedure done, be there for translations if they are required, even though all the doctors all speak English really well. It's a very hands-on service that we're offering. And Lola, my wife, anyone that meets her is just instantly falls in love with her. She's just a very wonderful, compassionate person, and does a great job at making people feel comfortable and relaxed in situations quite often that aren't the most relaxing of situations. Medical treatments quite often aren't, they're not necessarily a walk in the park or something that we all look forward to.
100%, yeah. And I mean, I was going to bring that up too. That was a question I had is, I've traveled a few places. I've been to the Dominican Republic. I've been to Mexico. We've traveled down, driven throughout most of the United States too. So we've been to some interesting places. But when you go to another country, it is culture shock as soon as you get there. And I was going to say, medical treatments are a pretty stressful thing anyway, and how tough it would be to go to another country and dive into that type of a system too. It's awesome to hear that you guys have definitely thought that through, and you've got people there that can kind of explain the situation one at a time. We've all had tour guides when we've gone to these places, and your experience is much better when you've got a tour guide that can bring you through some of those culture shock areas that might throw you off your game a little bit.
Yeah, absolutely. It makes a difference, and we've been finding with our clients that are coming down that it makes actually all the difference. Even in circumstances where the doctor or the physician speaks English really well, there can still be little nuances that are lost in translation. And so, yeah, it's something that we're finding more and more is a huge benefit to our clients that are coming down.
Awesome. Okay, cool. Let's flip onto your next window here. So yeah, your story here and why you do this. You and I chatted for about a half hour, 40 minutes or so, a week ago or so, and you actually did have three big events in your life that kind of showed you how the Mexican health system might be able to help people like us. Tell us about those a little bit.
Yeah, so I actually got ahead of myself a little bit and started talking about my son. So he's the reason we actually started this business. He injured his knee in a soccer game about 5 years ago. He was a very high level soccer player here in Mexico, and unfortunately in the game, guy came down on his knee and broke his ACL ligament in his knee. That, interesting enough, though, coincided with kind of COVID restrictions being lifted in Canada. And so we were able to come back, and we had a house at that time in Smithers still, come back to Smithers and check on the house and visit family and friends and all those types of things for the first time in quite a while. And so we didn't deal with his knee right away, other than finding out that he had a torn ACL. And we came back to BC, and by chance we were on Vancouver Island, and he ended up staying at a school on Vancouver Island.
Right.
And finished his high school career, if you want to call it that, out on Vancouver Island. But we did have this pending issue of his torn ACL that had to be dealt with. And so, because we were back in BC, we inquired in BC, and at that time it was a 2 to 3 year wait for him to get his ACL replacement.
Oh, wow.
And so, of course, for number one, an athlete and then a young person, that wasn't an option. So my wife phoned his coach, his coach for a soccer team here in Mexico, and inquired if he knew anyone. He said, yeah, absolutely. We have a really good guy in Guadalajara. So my wife, he gave my wife the number. My wife phoned thinking that it would more than likely be the clinic. And surprisingly enough, the doctor actually himself answered the phone.
Right.
And so my wife explained the situation, and he said, well, do you have any imaging? And luckily, we did. The injury happened in Mexico. And so in Mexico, you can get an MRI, same day, if you wish. And so as well as getting it same day, you actually are you're the owner of the results of that MRI. So we had a copy of the MRI on our phone, and so she sent it via WhatsApp to the doctor, and he said, give me 5 minutes, I'll take a look and call you back. And so he did. He called back 5 minutes later and said, yeah, your son has a torn ACL and a meniscus tear, and we need to fix it for sure.
Yeah.
And my wife said, well, when can you do it? And he was like, I can do it next week. And she was like, oh, wow. And that's amazing. And how much would it cost? And so at that time it was about $5,000 US. And so my wife said, okay, that sounds reasonable. And what now? And he said, phone my clinic and schedule the call. And so my wife did phone and scheduled it. And the time from that call to him having his ACL replacement surgery was a week.
Wow.
And so it was just amazing. But then the story is even more amazing for lots of different reasons, which are that this doctor actually isn't just any kind of run-of-the-mill doctor. It turns out he is the doctor. He's the Dr. Rafael Ortega. He's actually the doctor that does all of our orthopedic procedures, or his clinic does all of our orthopedic procedures for patients that come down, clients that come down.
Yeah.
And he's the team doctor for Mexico's national men's and women's soccer team. So wow. He's traveling with the national teams all over the world for anything to do with orthopedics. He's also the doctor to basically all of the professional athletes of any kind in Mexico. So there's some big names. So if you're a boxing fan, Canelo Alvarez, for example, is a wow. world famous boxer. He unfortunately recently lost his last bout, but win some, lose some. But he's Canelo's doctor. He's Checo Perez. If you're an F1 fan, F1 racing fan, Checo Perez is a patient. It just goes on and on. We don't have enough time to talk about all his patients. And so that was kind of one of the things that turned on the light bulb for us. It was like, this guy is literally one of the best, if not the best surgeons in Mexico. And he is answering the phone and giving us service within a week. And that kind of just blew us away, and talking with other people kind of, at the time when this was all happening with my son, it was like, this was not an option for people in Canada.
Yeah.
And so that kind of turned on the light bulb for us, and made us start thinking that maybe there was an opportunity to be helping people in Canada get some service that they're not getting in Canada.
Mm-hmm.
And that's where everything started. And so that from that day on, we kind of started helping friends of friends and friends of family and family get different things done here in Mexico, up until we actually founded the company and kind of brings us to today.
A couple of things you brought up there that drive me nuts in Canada and that I love that I'm hearing about Mexico. Number one, first of all, you go down there, doctor checks you out. Of course, there's going to be some documents that tell you all about your health. Here in Canada, you can pay up to $500 to $1,000 just to have them print off documents for you. Unbelievably insane that we have to pay extra money on top of what we pay insurance-wise just to have something printed off. I went through a battle with my doctor not long ago, and mine wasn't anything major. I just needed something for some insurance documents. They wanted to charge me $750 for it. And when I asked them for what their excuse was for doing something like that, I said, look, I can go buy a case of paper for $150. I can go buy an ink cartridge for $75. I'm like, where's the other $600 you guys are spending here? And she said, well, you're making money off of your insurance claim and we don't get paid to do this. And I said, what do you mean you don't get paid to do this? She said, insurance doesn't pay us to print off documents. And I went, oh my God, this is a business. You guys are trying to milk every dollar you can out of this system. You're not trying to help patients, or you are, but you're using it as just a vehicle to drive more dollars. And then I went into my doctor's office and I asked him, I said, where does that money go anyway? I said, that's off the insurance books. Nobody's seeing that. Where does that go? And he said, well, it's an office fund. So it turns out that money was actually going to the receptionists at the front desk. That was extra bonus pay for them. Wow. So it's just, it's a gross system at the end of the day, and you should be owning your own health information, especially in this day and age. I mean, back in the day, nobody could read it, so we didn't really care. You give me that document, it's a piece of garbage anyway. I don't know what it means. But now, we've got a lot of different avenues that we can hand that off to, even AI in this day and age. And AI can tell you things that most doctors might have missed. So I love that fact right off the top. Number two, talking to the doctor directly. There's an old game we played back when we were in elementary school called Telephone, where we all sat cross-legged, crisscross applesauce, and you started with a message at one end and you whispered it all the way down to the 10th kid down at the other end. Never did that message come through properly. Well, we're doing the exact same thing when it comes to our insurance companies and our doctors too. You've got 17 people you've got to go through. All those people better be perfect, pardon me, in their documentation. And if they're not, you're not going to get the treatment that you need. So being able to speak directly to the doctor right from day one, what an amazing service, and especially a doctor of that caliber. Mexico doesn't mess around when it comes to their big national sports guys, Canelo Alvarez being one of the biggest. Mexico's going to protect that guy through and through because, he's their pride. So, somebody like that being on that guy's list and him still answering the phone, that's pretty unbelievable. Yeah.
We just, another quick example of the service, we recently inquired for a client, who had some questions about an ACL replacement, and we phoned him and he answered, and he was literally at a game with the national team in Florida. So, who does that? But that said, it is a service here in Mexico that is not uncommon.
Yeah.
Mr. Ortega, Dr. Ortega, he gives an amazing service, and his clinic gives an amazing service, but people should not think that that's a one-off. It's very common here. This is a common service that we receive amongst all of our doctors and clinics here, and not just us. It's Mexican nationals would be very accustomed to this type of service as well. This is not something strange if you are in Mexico.
Right. So you had a tragedy in your family as well when your father passed away, and that kind of feeds into your business a little bit here and why you're passionate about what you're doing here. You want to explain kind of how that went down?
Yeah, for sure. So my father, he passed away unfortunately when he was 57 years old on a sheep hunting trip. Actually, that photo that's in the presentation was actually taken just a couple of days before he passed away. That was the trip he was on when he passed away.
Yeah.
But the interesting part, or how that maybe correlates with what we're doing, is he had his yearly physical done a week before he went on that hunting trip, and was told that he was in good health, that he didn't have anything to worry about. Now, obviously, a week later after the physical, he passed away. So there was most certainly something wrong or not identified in that checkup. And in my father's case, something quite unique is my father was an identical twin. And so my uncle, after everything kind of settled, after my dad passed, decided that he should probably, get checked out, do a extensive checkup.
Smart.
Just being an identical twin, there was probably some potential for correlations. And so he actually went down to Phoenix, to the Mayo Clinic in Phoenix, and did what they called their executive checkup. And during this checkup, he did identify some issues, and was able to mitigate those issues and live a number of more years, 15, 20 more years after that. And so we have a product that we offer, which is called our executive checkup. And it is our inspiration is really my dad, because we believe that if he would have had access to that checkup, he more than likely would be alive today.
Yeah.
It's something that is not what I would call what's the word? The word is escaping me. You have to apologize. Sometimes I'm thinking in Spanish and the word doesn't come out in English. But there's no special technologies involved in executive checkup. These are scans that all major hospitals should have available to them. It's just not something that's offered because it's time consuming and in depth. Yeah. But anyways, we create our executive checkup, and our executive checkup is a Mayo Clinic executive checkup. We're very fortunate. The main hospital that we work with in Guadalajara is the Hospital Porteous, and it's a Mayo Clinic affiliated hospital. And so the clinic that the checkup that we do is the same checkup you would get if you went to the Mayo Clinic in Phoenix or other locations.
Right.
The only difference being, number one, I don't even think people can get in for the executive checkup currently at the Mayo Clinic. There's such a demand for it that it's basically a waiting list.
Yeah.
And number two, you're looking at probably $5,000 or $6,000 US for an executive checkup in the States, where our checkup comes in at about $1,600 US. So it's something that we're really passionate about and really encouraging people to do. And it's actually one of the main it's one of the foundations of our business is the executive checkup and diagnostics.
Yeah.
Just number one, there's such a huge need for it seems like right now in Canada.
Yeah.
And number two, we have such great facilities in Mexico and access to them, and at what we feel like are quite reasonable costs, all things considered.
Yeah, I mean the living stats in Canada are dropping at a unbelievable rate right now. I did see a study the other day. It was talking about it was like the average age of death in each country. Canada's has dropped by 2 years since 2020. That's an unbelievable stat, because that normally moves a half month, maybe a month per year, depending on what happens in a country. For it to move 2 years in a 5-year span is the experts were saying it's unprecedented. They've never seen it in this country before, and normally they only see it in third world countries. That is very, very scary. As taxpayers, there's not much we can do at the end of the day to fix that. It's up to the government that we elect in, and we keep seeming to elect in governments that don't give a shit about this right now. So I appreciate that you were thinking outside the box and finding other opportunities. I know there's a lot of people that kind of have some issues with this right now too, and I kind of want to get into that with you right off the top.
Yeah.
When I put up the preview for this podcast, it was the biggest response I've ever had for a podcast so far. Most people just very excited to hear what you guys had to offer. But there was a couple of people that reached out and they said, well, do you know about the issues with that? And I said, no, tell me. And they said, well, there are some areas in Mexico where they're doing this travel healthcare, and the doctors are jacking their prices, and it's basically pricing the locals out of their health market. So you've been doing this for a while now. You went down there, you accessed it yourself in a few different ways before you started this business. So have you seen an increase in the price? Have you seen a gentrification in the healthcare that you're accessing now compared to when you were accessing it so many years ago?
Yeah, you know what? That's interesting, and I'm not going to say that hasn't happened or it doesn't exist. I can say that I haven't experienced it or seen it. There is part of me that maybe makes me feel like this could be the news potentially taking advantage of a situation, and I might use it's a different subject, but similar in regards to there's been some protests in Mexico City as of late, but in regards to rents going up. And so did these protests happen? Absolutely. They most certainly did happen, but it was a very small group of people and a very, what I'll call unique group of people. But if you surveyed the majority of Mexicans,
Yeah.
And ask them what their opinion is on foreigners coming to Mexico, being a good thing or a bad thing, nobody, I shouldn't say nobody. Obviously, there is some people that think it's a bad thing.
Yeah.
But the majority of people are very happy to receive people from other countries into Mexico. It's not a bad thing for Mexico. It's bringing money into Mexico. It's creating jobs for Mexicans. It's got a whole bunch of upside.
And that's why I asked the question
now,
I do. Like, they're pitching it as if it's this widespread problem going on, and the world has a major perception problem right now. They like to point to extreme cases and then act like it's the rule of law. And that's why I asked the question I did. I mean, look, we can get right down to it because of your experience. You accessed this 25 years ago when this health travel thing wasn't broadcast on the internet like it is right now and as popular as it is right now. So we can get right down to the data of the system you're working in right now. Have you seen any major increases right in the system you're working in since back then? And if you haven't, I mean, we can squash that right here in your business. There's always going to be an extreme case somewhere where some shit goes down. Is it the main case is always the question you've got to ask. So
it's a flat out no for where we are and what we're doing. It's a flat out no. Most certainly, in 25 years, there's been pricing increase, but
of course,
everything obviously has gotten more expensive over the years. None of those price increases are in relation to expats or foreigners coming to receive medical care, though.
There's a difference between gentrification and regular inflation. Inflation happens. Right. Gentrification is a forced thing. So, yeah, okay, that's awesome. Let's keep going through your deck here too. We talked about Miguel's knee. We talked about your father's passing too. Nicole's birth. We didn't really dive into that one yet.
Yeah, Nicole's birth actually. So that was actually more for us. That was actually. Our first insight to a problem or a struggling healthcare system in Canada. And that was when Nicole was born 25 years ago now. We at that time had a fishing lodge up in Smithers. And so our yearly routine would be to be in Mexico 10 months out of the year. And then we would travel up for September and October and run our fishing lodge in Smithers. Right. The year Nicole was born, we were doing a big renovation on the lodge though. And so we came up a little early, and because her birth date was scheduled to be not too far after the lodge was going to be wrapping up, we decided that Nicole would be born in Canada. So in Mexico, even 25 years ago, so this, 25 years ago, every doctor that needs to have a ultrasound machine, or I shouldn't say every doctor, in the private system, complete transparent, we do use a private system.
Right.
But any doctor that has the need for an ultrasound in their office just has an ultrasound machine in their office. And so in regards to Nicole's birth, my wife would go for her monthly checkup prior to leaving Mexico and get an ultrasound. And of course, they check the heartbeat and size and all those sorts of things. And we even have videos and all that type of stuff of each of those, ultrasounds and whatnot. And anyways, we left Canada, or we left Mexico, after our first couple checkups because of this renovation that we were doing at the lodge, and we got to Smithers and continued with our monthly checkups. But in Smithers, the monthly checkup was more, just the stethoscope and the more general, how are you feeling kind of stuff.
Yeah.
But no problems. Everything was going fine. In Mexico, they had estimated her birth to be around the middle of December.
Yeah.
And so, the lodge was ending at the end of October. We were going to have a month and a half before her birth, and everything should be hunky-dory. So we were doing our monthly checkups, and in October, the doctor said that he felt like my wife was pretty big. She was massive. Her belly was getting big, and he thought maybe it wouldn't be a bad idea just to, do an ultrasound, check the size of the baby, see how things were going. And so he scheduled an ultrasound that unfortunately was going to be over a month before we could get the ultrasound done. So that was going to be, towards the end of November, a month and a half. It basically was end of November, but we figured we were still okay, just because with the birth date kind of being mid-December, towards the end of December, it should have, not be a big deal, not be a problem. So anyways, finished the fishing season. We were in Smithers at my dad's house, kind of recovering from a fishing season, and November 27th, my wife's water broke and went into labor. So we took her up to the hospital in Smithers and started the process that turned into quite a terrifying process. It was very scary. You know how they say your children being born is supposed to be the happiest day of your life. Well, it was very happy, most certainly, but it was also, in my case, one of the most terrifying experiences of my life. And I won't go into the gory details, but the short version is that basically our daughter was too big for the passage that was presented to her. And so there was some complications there. It all turned out okay. Obviously, she's a beautiful, healthy 25-year-old girl. She's not a girl anymore. She's a lady now, but everything worked out. So I can't complain too much, but it was most certainly a scary circumstance that could have gone bad, and that most certainly could have been avoided with something as simple as an ultrasound.
Right.
And then another to give some perspective. At that time, we weren't living in Canada, so my wife is a non-resident, of course. So we had to pay for all of the services that were related to my wife having our daughter in BC. Of course, anything related to my daughter was covered by the medical system, but not my wife. So my wife's portion of that birth, which ended up being a natural birth and a couple of days in the hospital, came to about $10,000. Which was fine. We were happy to pay it, no complaints there, happy to pay it. That's the system, and we were happy to do it. But a bit of perspective, 6 years later, my son was born. He was actually born in Mexico. So because we knew my wife's birthing canal was not going to be big enough, we were very conscious of that. And, monthly measurements during the pregnancy at the monthly consults with the doctor, scheduled C-section. So scheduled C-section, private hospital, private room, private nurse. My wife stayed for 5 days in the hospital until she felt like she was feeling good enough to go back home. The total cost of that in Mexico, this would have been in 2006 when my son was born, was $3,000 US.
Wow.
For everything, for my wife, for my son, for everything. So just to give you a bit of context there, a bit of a difference between the two systems.
Unbelievable. 30%. You paid 30% of what you would have paid in Canada. That is crazy. Yeah. Okay.
And for something that theoretically I believe would probably be more expensive, like a C-section, which we had in Mexico, I think is a bit more expensive because you're talking about an operating room and those sorts of things versus, a natural birth, which was Smithers. So, and then of course, 5 days in a private room in a private hospital versus a couple days in the.
Oh yeah. So we're not even apples to apples here. It's probably 20%. Could be down to 15 once you start adding stuff like that in. Wow.
More than likely. Yeah.
Unbelievable. Okay. Let's keep going through your deck here too. How you guys are different a little bit. We've kind of gotten into this a little bit. You got personalized care. You're not a big agency. Your wife is the one that goes in there with them to make sure that they're comfortable, make sure that everything is communicated. You've talked about the doctors being the top, in Mexico and obviously so with their client list that they have. You live there. We've talked about that as well. The compassionate care a little bit. Tell me a little bit about that with your compassionate care from start to finish and how that's
so really I think it's just that kind of understanding actually, and the word medical tourism, everyone's heard it I think now in this day and age. It's a common word or name, and it's one that I don't like, and one one of the reasons that we call ourselves Mexico Health Concierge. Medical
Right.
and tourism to me don't go in the same sentence. Medical is something like we kind of talked about. It's scary. Where theoretically, if you're going to the doctors because something might not be going the way it should, or we're not feeling well, and so medical is one word, and tourism is usually a nice holiday on the beach somewhere, and it's fun and enjoyable. And so to me, those two things don't go together at all, medical tourism. And so we're a concierge service, and so really what we're there to try and do is just take out or eliminate as much as possible all of those things that make these treatments or procedures maybe somewhat uncomfortable or nerve-wracking, just trying to make them less so however we can. And so in our case, even beyond the medical treatments, it's just coming to a foreign country. So there's arrival, so we come and pick you up at the airport. It's we don't give you the name of the hotel. It's no, we'll be at the airport to pick you up. We'll take you to your hotel. We'll help you with your check-in. The next morning, we'll go with you to your appointment, and we know where it is, so you don't have to worry about finding it. During the appointment, you're in a foreign country, and like we talked about, that maybe doesn't, it feels a little scary. So we're there to try and keep that a little less scary. Do whatever we can do to after a procedure. Of course, there's the recovery, and so after you have an operation or procedure, quite often there's a time frame where you're uncomfortable and not feeling well. We're there to get your medications for you if you need. We're there to make inquiries for you. We're there to get you meals and food if you need. We're there basically for whatever you might need. And so we're just trying to take it kind of that next level of care and service to try and make people maybe a bit more open to the idea of traveling outside of the country to get this care, because we are very conscious and aware of the fact that it's not an easy ask to get people to go to Mexico for these things. Mexico, according to the news, is a scary place, very dangerous according to the news. You're probably going to get kidnapped. Obviously all these things aren't true. It's complete propaganda as far as I'm concerned, but we understand that people do have some apprehensions, and we want to try and do whatever we can to take away or lessen those apprehensions.
For sure. Yeah. Let's keep going on this a little bit. So let's talk a little bit about exactly where you guys are and how this travel works out. So that's what this slide's all about.
Yeah. So we're in Guadalajara. We're just opening another office here up in northern Mexico in Hermosillo, Sonora, but we'll focus right now, I think, today on Guadalajara.
Yeah.
We're in Guadalajara for a number of reasons, but the number one and main reason is Guadalajara is a hub for medical and healthcare in Mexico, even for Mexicans. It's known for medical care. It's one of the most technologically advanced cities in the country. It's actually, they call it the Silicon Valley of Mexico.
Right.
It's very modern, and I'm not going to say it has the only good hospitals in Mexico, but it most certainly has some of the best hospitals in Mexico. And so that's number one. Just access to a very high level of medical care. Yep. Number two is easy access now. It has very easy access for Canadians. There's now direct flights from Vancouver, Calgary, and Toronto to Calgary. So it's easier than ever, or to Guadalajara, sorry. So it's easier than ever to get to Guadalajara for Canadians. Yep. Number three, safety. It's very safe there. Number four, it has a great climate. The weather year round, it's got that kind of California to 75 to 85 degrees Fahrenheit year round. So beautiful weather. And another amazing thing about Guadalajara is for example, I could use the comparison with maybe Tijuana. So Tijuana is very well known for lots of different medical procedures and treatments. Anyone that's been to Tijuana knows it's not a really nice place, or at least in my opinion, it's not a super nice place.
Pretty dirty, yeah.
It most certainly has some nice areas, but it's not one of the nicer places in Mexico. Trust me. Speak in regards to safety or just beauty. It's not one of the, but it is one of the main hubs for people to receive medical care. Guadalajara is the complete opposite. Guadalajara is a cultural and historical mega center. It's just surrounded by so many beautiful and amazing things. So obviously people are always coming for medical or healthcare, but quite often, these things may not be invasive. It could be just a real simple diagnostic of some sort. We have a lady coming next week, for example, that's getting some diagnostics done. It's going to take her a couple days, but she's not going to be laid up after that, and so she's going to spend a couple 3 days doing some exploring, and so that's another amazing thing that Guadalajara has. There's just an endless list of things to see and do in or in the near vicinity to Guadalajara. So,
and you've got all the info on the cool stuff to do while you're off medical time too, I guess.
Absolutely, yeah. There's a long list, too long. But for example, everyone I think a little bit when you're maybe businesses or jobs, alcohol distribution.
Yep.
So tequila. So tequila is the town of Tequila. Yep. Jalisco is about an hour from Guadalajara. And so this is the birthplace of tequila, Jalisco, Mexico.
That's where my brand comes from, Don Julio and El Tequileño. We got two brands that are right in your area there. Yeah.
Well, you better come for a visit. It's tequila, Jalisco. It's amazing because of the tequila, but it's actually literally just a beautiful place. Like it's got these amazingly beautiful haciendas where they're making tequila, and just an amazing experience to spend the day there. And so that's an hour away, or right, 15 minutes away from where we are. There's, for example, the Coliseo, where you can go and watch traditional, authentic Mexican lucha libre,
right?
Which is actually, it's something everyone knows wrestling, but most people have never seen real wrestling, which is the lucha libre, and it is an amazing experience, and it's right there. And so, that food, amazing food. It's like I said, it's an endless list of things to do.
Oh, this is awesome. All right, let's keep going here. We got a lot to get to today. Oh, that's just an empty slide. So we've already kind of gotten into this a little bit, but we can talk about the centers and the hospitals that you're working with. You were talking about San Javier Hospital, the surgery center, and I'm going to mess up the pronunciation of that one.
That's okay. That's Puerta de Hierro. So that translates to steel door, basically, or metal door, let's call it. But it's our main hospital, Puerta de Hierro. It's actually in the area where we're located, where our office is, which is the area called Andares.
Right.
And that's a Mayo Clinic affiliated hospital and a JCI accredited hospital as well, which basically means that it meets or exceeds the standards of any hospital that you would find in the United States or Canada.
Yeah.
And so that's kind of what I'll call maybe our home hospital. That's basically about 500 meters where the majority of our clients stay and where our office is and where we live.
Right.
The Mediatros, that's actually the surgery center of Dr. Rafael Ortega, which was our son's orthopedic surgeon. And that's where we do all of our orthopedics, knees and hip replacements, ligament work, spinal surgeries, all of those sorts of things are done there. It's an amazing facility. It's brand new.
Yeah.
It's got everything in-house. So it's a place where you can literally go get your blood tests, your MRIs, your procedures, and then they have probably, don't quote me on this, I'm not great at judging sizes, but if I had to guess, probably close to 10 to 15,000 square foot rehabilitation center on site.
Wow.
Private rooms in the hospital, it's all right there. So that's Mediatros and great facility. And then San Javier, that's actually a Canadian Healthcare Council accredited hospital.
Yeah.
And another one of the hospitals that we use, and we use them a lot for diagnostics, and we have some really great specialists that we take clients to there.
That's awesome. Now you can see, it's kind of tough to see on the screen here, but there are some links to all of these hospitals and surgery centers here as well. As always with our podcasts, any links or anything that we look at will be available for you on the YouTube page through a link there. So make sure you go check that out as well if you're looking for some more info on this stuff too. We're just going to keep going through the slides here. Just some pictures of the hospitals and the doctors there, and then working with some of the patients.
Our doctors. Our doctors, I'll just maybe mention, all of our doctors we've vetted everyone that we work with. They all have the appropriate licensing and accreditations. The majority of them actually trained outside of Mexico, many of them in the United States or Europe.
Okay.
I'm not going to say we're 100% because actually worth mentioning, how we vetted or found many of our doctors was not necessarily, by who was going to make us the best business offer. It was actually more who was the best of the best in their field.
Right.
So, for example, in regards to orthopedics, Dr. Ortega is considered to be the best of the best in his field. And that's why we're with him. And so all the doctors we work with, that's kind of more the criteria than anything else, that they're the best of the best.
Yeah.
But then also what I was starting to say was not quite 100%, but I'd say about 98% of our doctors are also 100% fluent in English,
right.
Which is, of course, is very important and helps with the communications. Even though we are there with the patients all the time, we're there for that. The majority of the doctors do speak English as well.
Gotcha. I don't know what just happened to your window there, but you got really small.
So it's probably better that way.
That was weird. Okay, there we go. We fixed you. You're back again. Okay, let's keep going on your deck here then. I kind of want to get in. We do have a few slides here that are actually going to talk about some of the amazing services that are offered with you too. And here are some of them. So you've got the executive checkups and the diagnostic testing that we talked about. Actually, why don't we just, you sent me some brochures from each of these. Why don't we go through those now?
For sure.
Yeah, services. Here we go. So we'll start with the stem cell therapy, something that I'm really excited about. I've been doing a lot of looking into this in the last little while. And there's some weird regulations on stem cells in North America, just on how much you can give and how you can give them and things like that. Still very effective if you can get it in North America, but we're finding in places like Colombia and Mexico, the treatments seem to be working much better. What do you know about stem cells? What are they for? Because this is kind of a new thing that I think a lot of people aren't really aware of yet.
Yeah, so stem cells are amazing. I love stem cells. I'm a huge fan of stem cells for personal reasons, and that being actually our son. Our son got stem cells in his knee after his injury, and so they're amazing. Stem cells are amazing. One of the things that's making Mexico and some other Latin American countries kind of stand out, or maybe take the lead a little bit in regards to stem cells, is that in Mexico you can use umbilical cord and placental derived stem cells, which are widely regarded as kind of the best of the best. They're brand new, unadulterated. They're the best of the best, pure. And so they help for so many different things. It's a wide range of things, but there you go, as you go down. So autism, actually, so children, as we all know, unfortunately, autism seems to be getting to be something that is more and more common.
I'm one of them.
Every day. Yeah. And okay. Yeah. We, in our family as well, my nephew has autism, but having some really, really great outcomes. And something I'll say about stem cells is actually important. Stem cells aren't necessarily a cure for anything.
For sure.
But what they do help is really improve symptom, or like diminish symptoms, I guess maybe is a better way of saying it, in many regards. So for example, with autism, obviously it manifests in lots of different ways. But for example, one of the things could be tics. So, parents are reporting, tics being reduced by 50%, or the ability to pay attention drastically improved, things of that nature.
Right.
Alzheimer's and dementia, same thing. Once again,
I've read up on this one recently. This is really exciting stuff. Yeah.
Oh yeah. And this is the other thing too, is like stem cells maybe 15 years ago, could have maybe been considered maybe voodoo or witchcraft to some extent. There wasn't a lot known about them, but in this day and age, we're way beyond that. And there's a large, what's the way, how do I say this? There's a lot of documentation out there via very reliable sources, scientific papers, the information's out there. This is beyond voodoo and witchcraft. This is a real science that has real positive outcomes, and they're using it and researching it a lot.
Yeah, and it's actually taking over for a lot of surgeries out there too. I've got a buddy that used to do professional dirt bike riding, and he used to injure himself at least a couple times a year because that's a pretty brutal sport. And it's always knees, it's always muscle tears, it's always things like that. And like you said, he would, blow out his knee, and he said it would be normally a 6 month to a 9 month recovery time, depending on how bad it was. He said when he started on stem cells and on CBD for his recovery, he said he cut it down to 25% of that time. He said he was back in competition sometimes within a month to 2 months, rather than it being 6 months to 9 months. So, I mean, the papers are out there, and if you know somebody that's got it, they can tell you too. This is real for sure. And everything from orthopedic and joint conditions, stroke recovery, Parkinson's disease, they're seeing some big things on here too.
Yeah, I think the short answer to stem cells is how do they work or what are they great at doing? It's really what they do is bring down inflammation.
That's right.
They're amazing at bringing down inflammation, and so yeah, I would encourage anyone that's interested to spend some time looking into it, because at this point it's a proven therapeutic, I believe, that has some really justifiable uses. It's amazing. We're doing actually a lot of it. It's actually probably the second or third most popular product that we're offering.
Oh, I hit the wrong window. There it is. Yeah. That's really exciting stuff, actually. And you know what? We're going to have these slides right here on my Facebook page, and I will link those through this YouTube video as well. So if you are watching this on a Facebook clip, head over to YouTube. All these links will be there for you to check out. Let's keep going, though, too. Dental care is another thing that is offered. Tell me a little bit about that.
Yeah, so dental care, Mexico is really well known already for dental care. I think it's on everyone's radar, probably, or I shouldn't say everyone, but on many people's radar already. Mm-hmm. And so it is something that we offer, and we work with a clinic in Guadalajara that's widely recognized as one of the best, as I mentioned, as we do with all of our partners. Dr. Alejandra Cruz. Basically it's so funny. We're used to the doctor or the dentist, in Canada. These dentist office people come in for their first visit, and they're always blown away. They think that we've taken them to the wrong place. They think we've gotten lost somewhere along the way, because it does not look like your traditional dentist office. They look maybe more like what a Fortune 500 company office might look like.
Right.
They're beautiful offices and full of the most modern equipment and technology that you could imagine.
Right.
And then on top of it, at a price that is much more affordable than in Canada. So for example, depending on where you talk to people, like right now, as I understand it from talking with our clients and patients, an implant right now in Canada, you're looking somewhere maybe between $5,000 and $7,000 for an implant.
Right.
In Mexico, you're going to be looking at about $1,500 US for an implant.
Wow.
And so, it's done in an amazing facility by one of the best dentists in the country. You're getting the most modern, up-to-date, technologically advanced equipment used on you, and at just a fraction of the cost. And so what I tell people is, if you need one implant, you're probably not going to save much money at the end of the day, but you're going to get to go to Mexico probably for free.
Yeah.
So that, if you need two dental implants, you're making money for sure.
Now you're making your cash. Yeah.
And so dental implants, veneers. Our doctor that we work with does something that she calls a smile makeover, which is a really amazing product that she has. And even just like general checkups and cleanings and things like that. Obviously, you're not going to come probably to Mexico for something like that. But a lot of our clients are coming down for maybe an executive checkup.
Yeah.
And then they're also adding on maybe a specialist visit, because they've come to Mexico for their executive checkup. So they're going to go see the specialist about something. And then they're like, what the heck, I'm here. I'll go see the dentist and get a checkup and a cleaning. And so people kind of, add on to their trips.
Right. Invisalign, orthodontics, all available too. Now, one thing people are going to be worried about, of course, is safety and comfort. We've seen the news stories. We've seen the horror stories out there too. Talk a little bit about those assurances.
Yeah. So we kind of touched the subject a little bit already. What, the news is saying one thing, and then what's really happening. And so the news is reporting that, gentrification and the locals can't have access now to medical care. Well, the news is also reporting, blood in the streets in Mexico, and that it's extremely dangerous. And we see the news. And I'm not gonna say that there isn't some things happening in Mexico, because there is most certainly some things happening in Mexico. But I think saying that there's also some things happening in Canada right now too would be warranted, right? And
You're
so,
not wrong. Yep.
If I want to scare my kids currently, I don't show them around Mexico. I take them back to Canada. And take them to Vancouver or Prince George.
I was going to say, bring them to PG. We're burning down buildings left, right, and center up here. So we got some examples.
Well, I was actually in Prince George. I was in Prince George for a presentation the night the brewery was burnt down, and so once again, I'm not denying that there aren't some bad things happening in Mexico, because there are for sure, but they're not happening anywhere where we are. Where we are is actually probably one of the safest places, not only in Mexico, but maybe the world. It's a very high-end area. It's beautiful.
Yeah.
There is nothing to be concerned about in that regard where we are here in Mexico, for sure.
Awesome.
And then once again, in regards to like the doctors and clinics, we've, one of the reasons to potentially come with us is because we've done the work. We've put in the time and energy to vetting these doctors, to checking their certifications, to checking their licenses, to checking their references, to make sure that our clients are getting access to the best of the best, the doctors that aren't gonna, that we've heard about on the news too, that aren't gonna take out your kidney when you go to get something else done.
100%. Yeah.
Although I've never actually heard of that happening in Mexico. I think maybe in some Eastern Bloc countries potentially, but I think also that could be maybe some crazy news stories too.
I'm sure it's a little A, little B. Yeah, absolutely. Yeah. A couple more things that are offered there we'll get into. Advanced diagnosis for in Guadalajara. Now, this dives into like radiology, cardiac, and even cancer screening and early detection and things like that too. Let's dive into that a bit, because these are important.
Yeah, so this is actually another really popular product for us. And so we're having a lot of people get in touch with us and telling us things like, I went to the doctor and my liver enzymes are high. They say I have liver disease and there's nothing they can do.
Right.
And coming to us and asking for a second opinion, and we're taking their labs that they have from Canada, and we're doing a consult with a liver specialist here in Mexico, and the liver specialist saying that there's probably something going on with your liver, but it doesn't look like it's untreatable. You most certainly need to have some more testing done.
Yeah.
So we can determine what is going on with your liver. But from what we're seeing, it's not life-ending, and come to Mexico and give us a couple of days and we'll figure out for sure what's going on. And so a lot of things of that nature, coronary or cardiovascular things. We had a lady, for example, she was seeing a rheumatologist in Canada for the last 12 years. The rheumatologist prescribed her medicine, and she was down for the executive checkup, and she just wanted a second opinion on the medication she was taking. Yeah. Because it was having some side effects. We took her to the rheumatologist. The rheumatologist asked her which century she was from, and we were kind of like, "What do you mean? I don't understand." And she said, "This medication you're taking is something we haven't used here for a long time. It's considered by many not a great medication. So we need to do some more tests and see what's going on." And so the next day we took her in for the tests that were requested by the doctor, got the test done. Yeah. So this is another example of how great the services are,
turning things around.
Yeah. Well, that evening we go see the specialist. That next morning we do the test the specialist asked for. And then that afternoon again, we're back with the same specialist for a follow-up. And the specialist said, "I've got good news and bad news. The good news is you don't have rheumatoid arthritis. You're in remission. So you don't need to take this medication. The bad news is you've been taking this medication for 12 years and now, I don't know if that's had some maybe negative effects on it, right? And so yeah, a couple quick examples of the diagnostics that, people coming down seeing the specialist. We have a company called Clearview that has a full body MRI scan that they do. That's really good for, early cancer detection, as well as some neurological disorders and things of that nature, or cancer screening. Imaging, MRIs. We had a gentleman come down for some stem cells, and he told the story of, he was having some hip pain in Canada. His physio told him in Canada that there was something wrong with his hips, that, he should get it checked out. He asked his GP. His GP said, how the hell would your physical therapist know what's wrong with your hip? And kind of that was as far as it got, because the GP wouldn't send him for an MRI or to a specialist. So he was down for stem cells. We got him an MRI, and his hips, he's got some stuff going on in his hips. So another example, just imaging. You can, if you wanted to, if we were in Mexico right now, and Matt, you said to me, hey Jim, I want to go get an MRI or a CT, or I'd say, let's go. And in 10 minutes, we'd be at our clinic that we use, and you'd have it, and you'd have the results you'd have the hard copy results before you left the clinic, and you'd have the interpretation probably in an hour.
Plus, any tests they did, you'd be walking away with the documents so that you could use that later on. If something else came up, you could say, hey, I just got this done a month ago. Look at these levels. You see anything there? And now you can actually follow it and actually take control of your own health a little bit, which would be nice, because it seems like we've handed that off to people that either can't handle the load to service us properly or don't care to.
That's right.
One or the other. The great thing is, I don't like to totally shit on the system up here completely. There are good doctors working in our bad systems. So I think there are some opportunities here to just maybe get some tests done that those doctors couldn't even access themselves, because they just don't have access to the machinery or the process or whatever. They can then take the data from. So
I'm glad you brought that up, because that actually is an important point. And when I'm giving my presentation, I try and bring that up. And I don't think I fault any of the medical professionals, the doctors, the nurses, the technicians, and any of those people. They're, and I have many friends that are doctors and technicians and lab techs and all those things. They're working in the system that they've been presented, and it's maybe a broken system, but that's not their fault. They're doing the best that they can with the system they've been presented. So
that's right. Yeah, I don't want to misspeak on that. I don't want people to think that I'm, shitting on the people that are doing their best and working in a tough system. So that's not what we're trying to do here.
I agree.
Keep going with a couple more things that you've got available. Orthopedic care. We kind of got into this already with the story of your son and kind of what's available there. We don't have to dive into it too much. You talked about Rafael Ortega. Anything else you wanted to add to that? I guess we can go into this here, just the advanced procedures that are offered.
Yeah, so like if you just scroll up a little bit there, Matt, a little bit down, proven experiences and outcomes. So just to give you an idea of the clinic, this is this is what these guys do. They're doing this all day long, every day, all year long, and so they're giving 18,000 plus consults a year. I mentioned they have an in-house physio and rehabilitation center, 47,000 plus sessions a year. So when I say it's a 10,000 square foot plus rehab facility, people are probably like, yeah, bullshit, I don't believe it. Well, if you're giving that many sessions a year, you got to imagine that it's a pretty good size space.
No doubt.
And a lot of these are like athletes, professional athletes, like I mentioned. 15,000 plus surgical procedures, plus in another 600 or more robotic surgeries. And so, this is cutting edge, very advanced, modern facility. And once again, the best of the best. And I think probably for the orthopedics, what I might mention is in Canada, that's one of the ones right now that has a big wait.
Right.
And so, a lot of people right now, time is of the essence. And when you have a bad knee or a bad hip and you can't be out and about doing the things you want, a 2-year wait is a 2-year wait. That's 2 years missed on doing things that you love to do. And so,
your story with your son points that out perfectly too. I mean, he was, at the time of proving himself and building his skills to possibly become a soccer star. You can't take 2 or 3 years out at that time to go deal with something like that. Otherwise, you're giving up on that dream. So that proves it right there.
Yeah, that's right. That's right. So I think that's really what we have to offer in regards to orthopedics is just time. We can give people back some time potentially, and the turn, really the process. In our case, it was a week. I think under most circumstances, the process realistically for most people would be, let's call it a month from the day you make contact with us. You could probably be a month out from getting your procedure done. And so, that involves, talking to us, having an online consult with us. From there, it's, passing your information on to the doctors, having an online consult with them. Yeah. And then from there, making all the arrangements and so on and so forth. But it's still, 1 month compared to a couple of years is still
night and day.
Yeah.
And then finally, we talked about the executive health checkup too. But this is really important for a lot of people now. Like I said, back in the day, it didn't really matter if you had this data on your health because you couldn't read it anyway. So, I lost you. Hold on, let's get you. There we go. Now, we've got all these tools where you can actually read your health data. So going down and getting something like this done and walking away with a booklet of, your stats, your data, your blood, your this, your that, and being able to come back to Canada with that, I think has some pretty serious value to it, especially for us over 40 guys.
Yeah, this is the one that I really ask people to really contemplate. This in the grand scheme of things, it's a low barrier, low cost of entry. It's not terribly expensive to have it done. Mm-hmm. There's no risks. The biggest risk to having this done is probably going to be the flight down. Right. It's a blood test and ultrasounds and some MRIs and things of that nature, but it can tell you so much. And as we all know in this day and age that, when it comes to our health, early detection, finding out early makes all the difference in the world. Right. And so, this test can tell you a lot about where you're at, things that you have going on. And, it's kind of funny actually, Matt, when we first started this, it was initially, I don't know what I was thinking. I think maybe I thought everyone that came down was just going to be 100% healthy and we were never going to find anything. But we do find things. We do find things that people had no idea that they had going on. But as a result of finding these things out, you can take preventative measures. And so, for example, one of the big ones is cancer. I freaking hate cancer. We try and help people as much as we can with cancer, but if I could help just prevent people from getting cancer, that would be what I would love to focus on the most because it's such a horrible disease. And this product can help identify cancer in the beginning stages. And when you know you have cancer in stage 1 versus stage 4, it makes a huge difference in the outcome. And so what I tell people is, if you're thinking about going on a vacation, come down to Guadalajara. There's, like we talked about, some amazing things to do and see in and around Guadalajara. It's close to Puerto Vallarta. It's a 15-minute flight from Puerto Vallarta or a 2-hour drive from Puerto Vallarta. Come down, give us a day, get your executive checkup done, and figure out where you're at with your health, and then go have a good vacation. And you've done yourself a great favor in doing that.
Absolutely, yeah. I think we've hit it all, man. Is there anything that you think we've missed here that people should know about this opportunity?
Yeah, I don't think so. I think all I might add is, we realize, like I said, that, it is a big ask to ask people to come all the way to Mexico to receive medical care or health care. But we're aware of that. And so we would encourage people to ask questions, to reach out. We're more than happy to jump on calls. We're actually doing presentations in person. We were up in the north this summer doing some. We will be back next summer to do in-person presentations, but we're also going to start doing online presentations. So,
no winter trips, Jimmy?
Yeah, I'm so busy in the winter, I just can't spare the time, unfortunately. But yeah, come to one of our online presentations. We're going to start doing them monthly. Ask questions. We're happy to answer them because, like I said, we realize it is a big ask for people to do it. But so far, 100% of our clients that have come down, they're just blown away. They're blown away. It's nothing what they thought it was going to be. That, you know, Mexico has this perception that, you know, it's a bunch of banditos running around, or people with sombreros and, you know, people come down, they see the facilities in the hospital in the area where we are, and quite often, you know, it's like, did we go through a time warp somewhere? Are we in, you know, this can't be Mexico, because it actually, it in lots of ways it doesn't seem like Mexico.
Right.
So prior to getting to Mexico with us, you know, ask us questions, come to an online presentation, reach out, follow us on social media. And if we can answer a question for you, we're more than happy to do that.
And I can attest to that too. You know, I reach out to a lot of people asking for podcasts and things like that. And sometimes it takes 7-8 tries to get through to a lot of different people. Jim got back to me freaking immediately. I think within minutes of me sending a message and saying, "Hey man, interested in talking about this?" Instantly got back to me, and it's been very easy to communicate with you the entire time. So, you know, I can attest to the fact that this is a business that is very active when it comes to the communication side of things, and that's going to be important when people are accessing a service like this that they're used to accessing at home, but maybe see some opportunities in accessing a service that might be a little bit better somewhere else in this current time. So, yeah, thanks for coming on, man. This is awesome. I'm going to, like I said, we're going to post this online in its entirety. I'm also going to cut a bunch of clips out of this too, because I think we hit a bunch of singular points that I think could be very, very valuable to people too. So we're going to blast this all over Facebook over the next couple of weeks. I'm also going to put links in for your website and links to some of the documents that we have here. I'll take a JPEG of them and put them up on my Facebook page, and we'll link it all through the YouTube video here too. So if anybody wants to see everything that we chatted about here and get links to the website, head over to the YouTube page, check out the video that's titled James Britton, Mexico Health Concierge, and you'll find all the documents there. Jim, thanks very much for hanging out with me for, what did we do? An hour and 11 minutes today. I really appreciate that, and the platform's always open. I know that you guys are, we chatted earlier about some things that you're working on right now that could be coming up in the near future. When that happens, the platform's open for you if you want to do this again. So reach out anytime. We'd love to chat with you.
I appreciate that. Yeah, I really appreciate that, Matt, and appreciate your time and your listeners' time. And yeah, we'll look forward to next time.
Absolutely. Thanks a ton, man.